viral infection. So this will be our topic, and we are just going to deal with the rashes. So how is the rashes formed? So to start with, we are going to ask some questions. Check if you can recollect. So what are the characteristic findings of the rash found in the chickenpox? Then the second question we want to ask you is, how are the rashes in case of the rubella? In case of rubella, what are the characteristic findings of the rashes? So in this video, we'll find the answers to these questions and learn in detail. To begin with, we start with chickenpox. So this chickenpox, the rash, if you see, it appears on the first day of the fever, And there is also the centripetal distribution. There is the centripetal distribution. And it is pleomorphic. Then there is also the dewdrops. There is dewdrops on rose petal appearance. Next disease we're going to see is the measles. So what happens in the measles? So it appears on the fourth day. So it appears on the fourth day and it appears on the face. It appears on the face as well as the retroauricular origin. Then we look at the rubella. So what is this rubella? So in rubella, the rash, it occurs on day 1. So in rubella, it is on day 1 of the face. So it happens on the face. Next, we look at the erythema infectiosum. So what is this and how is this? So the erythema infectiosum. So in case of the erythema infectiosum, the rash, it appears on the cheeks. So it's a rash of the cheek. So erythema infectiosum, it is commonly known as the slabbed cheek appearance. And other thing to note is that it moves to trunk. It moves to the trunk as well as to the extremities. Then we also have the exanthum subitum. So we have the exanthum subitum. So in case of the exanthum subitum, the rash characteristics is that there are macules or maculopapular rash. There are macules or the maculopapular rash which is present. And next we also look at the infectious mononucleosis. So in infectious mononucleosis, it is associated with the maculopapular rash, the MP rash. Now we are going to answer our questions which we asked. So the first question we asked was, how are the rashes in case of the chickenpox? So in terms of the chickenpox, it appears on the first day of the fever. And there is the centripetal. There is centripetal distribution. Then it is also the pleomorphic, and there are dewdrops. There are dewdrops on rose petal. Dewdrops on the rose petal appearance is present. The next question we asked was, in case of rubella, what are the findings? So in terms of the rubella, there is rash. So the rash, it appears on the day 1 and it is on the face. Now to check our knowledge from this video, we are going to ask some bonus questions. So you can answer these bonus questions in the comments. So the first question we want to ask is, how are the rash in case of the measles? And the next important, we want to ask in case of the erythema infectiosum. Erythema infectiosum, how is the rash formed?